Hi, I'm Jennifer.
I'm Lindsay.
I'm Foster.
And our presentation is on the impact of creative therapies on hospitalized children with ASD.
So as we have discussed throughout our lectures, children with autism can be diagnosed with a variety of comorbidities or co-occurring conditions, some of which may result in periodic or even frequent stays in the hospital. As children with autism already are impacted by a number of behavioral and developmental components, hospitalization can further increase the impact of these behaviors. In general, hospitalization can greatly impact the child, resulting in reduced mastery and control, increased presence of anxious behaviors, additional fear and stress, and sometimes aggression. Due to these impacts of hospitalization, behaviors of children on the autism spectrum are further amplified. As Rosemary and Taylor briefly discussed in their presentation on hospitalized children with autism, Johnson and Rodriguez identified 4 behaviors that are presented in hospitalized children with ASD, including noncompliance, hyperactivity, sensory defensiveness, and self-injury. The challenge with these increased behaviors is that they can greatly impact the care that a child receives and the ability to be discharged from the hospital. These behavioral components can be a result of numerous factors, including the inability to communicate efficiently and communicate their needs, especially if the child's nonverbal, having their routine and that consistency disrupted, as well as the stress and anxiety that results from pain or discomfort that the child could be experiencing. Therefore, it's especially critical to prepare a child for these experiences and for non-familiar people or social situations, and adapting the patient's care to meet their needs for this communication or routine. Overall, the goal for treatment should also be to minimize the maladaptive behaviors that could potentially disrupt the patient's care. It is essential for all professionals to have an increased understanding of these behaviors that may present themselves, as well as the challenges that could potentially ensue, in order to be able to provide the most holistic and effective patient care, while also accounting for the autism diagnosis and medical components. Throughout the course, we've discussed the importance of communication across disciplines, and this does not stop with the patient's hospitalization. Interdisciplinary team members, such as art and music therapists, comprise creative arts therapies that can provide specific interventions that are targeted towards increasing a child's familiarity with the hospital setting, while also enabling them to develop opportunities for self-expression and coping. For the purpose of this presentation, we'll be discussing creative therapies as they apply to art and music therapy in the context of pediatric hospitalization. So what exactly makes creative therapy so beneficial for children with autism as well as those in the healthcare setting? As I briefly mentioned, hospitalization can greatly limit the control that a child has in their care. Creative therapies provide children with that control by giving them the power to guide their sessions wherever they'd like. Additionally, opportunities for self-expression are a significant goal of creative therapies and can be extremely beneficial for children who may be nonverbal or do not have the language to describe emotions they may be feeling. Creative therapies create a medium for self-expression that is unique and allows children to communicate without words. Creative arts therapies implement components of play and freedom. Play is a child's natural form of coping with potentially traumatic or stressful situations, so creative therapies allow the perfect opportunity to cope in a natural way. Now that we've talked briefly about creative therapies, we'll move to Foster so she can talk a little bit more about music therapy.
So let's take a closer look at music therapy. Music therapy has been defined as a research-based practice and profession in which music is used to actively support people as they strive to improve their health, functioning, and well-being. Music therapy can be used as an intervention for a number of conditions, as it is a comprehensive interdisciplinary field that integrates psychology, medicine, music, and education. The diversity, complexity, and individuality of music also make it an ideal therapeutic tool for addressing a variety of needs. With music therapy, a wide range of goals is addressed, although the predominant broad focuses are on supporting the children's communication and social skills. According to one study I found, high numbers of music therapists are working with children in groups, which include typically developing children or those who might have alternative challenges, which encourages participation in learning and social activities. Other goals of music therapy include emotional expression through musical instruments and improvement of sensory perception. Additionally, music therapy can promote brain development in children while it facilitates the development of multiple abilities, including attention, memory, imagination, and abstract thinking. So how does music therapy benefit kids with ASD? Music therapy is now considered to be a promising intervention for meeting the social, emotional, and communication needs of children who have ASD. But how exactly does this work? According to one article, music forms complex auditory stimuli through the rhythm and melody and causes emotional resonance through exposure to different music information. Basically, music therapy interventions can trigger the limbic system of the brain by evoking deep emotion through music. Music therapy can also improve a child's ability to interpret sensory information, increase their language skills, and ultimately improve their behavior because they have an outlet for expression. Some examples of music therapy interventions used with the ASD population include singing, playing musical instruments, rhythm training, music games, musical storytelling, and listening to music.
So as Foster has mentioned, music therapy can be especially beneficial for children on the autism spectrum. Firstly, research has shown that children with autism are more compliant and respond to requests more frequently when they're engaged in music therapy. This can be directly applied to a child's non-compliant behavior in the hospital setting and can be used in collaboration with the interdisciplinary team to foster greater compliance during procedures. The music therapy can provide that support during procedures to also minimize the anxiety that may be experienced. Since hospitalization can be especially anxiety-provoking for individuals on the spectrum, implementation of music repetition and therapy can minimize these anxiety-provoking behaviors. Ideally, classical music or a predictable rhythm is the most effective in alleviating this anxiety. Music therapists can advocate for the playing of repetitive music or soothing sounds in the child's room to further reduce this anxiety. Additionally, music therapy is a non-pharmacological method for pain management, which can be used if the child is experiencing any of the pain or discomfort that we talked about earlier. Music can also be used as a manner of self-expression and communication in the hospital setting for those who may not be able to communicate verbally. Music and lyrics can be used to represent different emotions or feelings, which can be directly communicated back to the interdisciplinary team. Pairing music with different emotions can help foster skills in emotional recognition. Social song stories can also be utilized to prepare a child with autism for different aspects of the hospital, while also encouraging particular social responses throughout these experiences by identifying a target behavior and encouraging an appropriate response. Music therapy targets a multitude of behaviors of autism and stressors of hospitalization while providing this opportunity to channel them in a productive way.
So let's see how music therapy works.
This little light of mine, sleeping, you sleeping, there, morning, see. Someday we'll find the rainbow connection. The lovers and the dreamers. Let's do from Sunday, ready? Someday we'll ready go. Someday we'll find the rainbow connection. The lovers, the dreamers, and me.
Now Jen is going to explain the benefits of art therapy.
Art therapy is a tool that is used in many different settings in which the clients use art media, the process of creating art, and their resulting artwork to explore feelings and achieve other specific goals. The main ideals are rooted in psychoanalytic and psychodynamic theory, but many art therapists have also embraced other philosophies such as cognitive art therapy, existentialist art therapy, and narrative art therapy. It is typically considered to be a complementary or adjunctive therapy treatment that is used in combination with other therapies as well. Art therapy can be utilized in either a group or individual setting, depending on what the therapist thinks will most benefit the child. There are three main goals that art therapy sets out to achieve. The first one is recreational. This refers to the ability to detach from problems someone may be having, relax, and rest. The second goal is educational. When achieving this goal, the therapist hopes that art therapy will provide information to help reflect on the meaning and purpose of life, as well as to disclose one's own desires and needs. Lastly, there is a corrective goal. This is when art therapy helps to transform harmful mechanisms that mainly cause negative self-image and relations with others into more valuable behaviors. Someone can utilize art therapy with the intention of tackling all three of these goals or a combination of them. Art therapy can potentially benefit children with autism in many different ways. As we know, children with autism often struggle with communication skills. Art therapy can help to encourage those communication skills in a child who may find it easier to process objects rather than faces. It exposes the child to different types of communication and can hopefully help to improve these skills. If the child experiences group sessions, it can also help with social communication and engaging with peers. Art therapy can help to facilitate the child's awareness of self as well. By relating themselves to their artwork and discussing it with their therapist, they can work on understanding this sense of self. Children can practice engaging different senses and increasing their flexibility in thinking. Different art media can help children experience different textures, sights, and smells. Using fluid or more easily manipulated art materials such as Play-Doh or watercolors can help them practice flexibility. The idea of improved learning skills refers to the development of attention and task orientation, the enhancement of symbolic thinking, and the development of imagination throughout the art-making process. Studies have also shown that the art-making process encourages relaxation at school and at home, improves sensory and emotional regulation, and less anxiety and anger. While art therapy may impact different children in different ways, there are many skills that art therapy can help to improve.
The visual and tactile nature of art therapy promotes a medium for self-regulation and self-stimulation activities that can potentially be more appropriate for hospitalization than a child's normal methods of self-regulation. Although enabling children to engage in these self-stimulating behaviors is very important, it can sometimes interfere with care, so providing alternatives such as art therapy can be very effective. One of the primary goals for art therapy is creating this opportunity for sensory regulation and integration. Art therapy can help a child to gain an increased tolerance for stimuli that could potentially be unpleasing. By providing a safe and appropriate opportunity for a child to engage and confront stimuli that may be otherwise repulsive or uncomfortable, they have the opportunity for familiarization and desensitization. Something such as the smell of an alcohol wipe or the feeling of a glove on their skin can result in overstimulation. However, art therapists can work with children on the spectrum to provide that opportunity for familiarization and preparation that is so essential. Additional opportunities include channeling a sensory fixation into productive art making. So for example, if a child is fixated on pulling out the tape on an IV, medical art can be made that encourages that release and self-regulation in a more appropriate way that does not impact their care. Art therapists can use assessments to better understand a child's developmental level, while art making can also encourage developmental growth. Hospitalization can encourage regression in children due to the high stress environment. Art therapy can mitigate some of this regression by enabling children to continue refining their fine motor skills and social skills while also encouraging communication. Alternatively, art therapy is not just limited to creating painting or creating sculptures. Therapy can also incorporate video and visual media as well. Technology can be used to develop visual social stories or role play in the hospital setting to encourage compliance as well as preparation. Ultimately, art making can help children develop safe and productive ways of expressing these emotions that can potentially reduce outbursts and maladaptive behaviors.
Now we'll take a look at a video that talks a little bit more about art therapy.
5-year-old Yuri Hatsarabu likes to draw, but this is more than just about making pictures.
Who's this? Those are passenger cars. Those are passenger cars.
Yuri Hut is among 25 children with autism working with art therapist Michelle Chavez at Rainbow Babies and Children's Hospital on a special project.
Art therapy is a mental health profession that aids in expression and coping. It promotes mental health and emotional health by using the art processes.
Sometimes Yuri Hut has difficulty expressing himself with words, but he can get his thoughts across on paper.
That's why it's so detailed, because he's talking to us. He's not creating a piece of art as far as he's concerned. He's talking to us.
Like many children with autism, Yuri Hut is a visual learner. That's why Mom plans out his day with pictures. So doing art therapy has become a perfect fit for him.
Before this was in our lives, he was very frustrated. And anybody would be frustrated if you want to talk to people, but you cannot. So he was very frustrated and miserable, and now it's a very calming process and a means of understanding him.
Obviously, it's working with him because he's incredibly verbal now, as well as social skills.
I think it was beautiful because you made it.
Yes, I did.
The World Through My Eyes exhibit, featuring 25 pieces of the children's favorite artwork, will be showcased at a professional gallery next month. And this is meant to do more than just showcase their talent.
This is an opportunity to speak to the world.
To give the public a glimpse into their world, what it means to have autism, and what it means to express yourself visually rather than verbally.
For your child's health, Maria Scally, Fox 8 News, Cleveland.
Lastly, we wanted to end our presentation with this quote: "But out of limitations comes creativity." We chose this quote because we felt like it captures the heart of what creative therapies are all about. Here are our references, and thank you for watching our presentation.